This is part 7 of our module, Drugs Acting on the Cardiovascular System, specifically drugs affecting blood coagulation, which is chapter 48 of our reference book. For our learning objectives, upon completion of this chapter, future ENs will be able to outline the mechanism by which blood clots form and dissolve in the body, correlating this information with the actions of drugs used to affect blood clotting, describe the therapeutic actions, indications, pharmacokinetics, contraindications, most common adverse reactions, and important drug-to-drug interactions associated with drugs affecting blood coagulation, discuss the use of drugs that affect blood coagulation across the lifespan, compare and contrast the prototype drugs, aspirin, heparin, urokinase, anti-hemophilic factor, and aminocaproic acid with other agents used to affect blood coagulation, and outline the nursing considerations, including important teaching points for patients receiving drugs used to affect blood coagulation. So, blood coagulation is a balance of procoagulants and anticoagulants. Vascular system maintain a balance between coagulation, which is the solid state, and need to unclot, which is also known as reverse coagulation. People injure their blood vessels sometime in life. Drugs affecting blood coagulation work at various steps in blood clotting and blood dissolving processes to restore balance needed to maintain the cardiovascular system. So you have there drug therapy across the lifespan. I will leave it up to you to look closer when you get a copy of your PLP. As mentioned previously, people injure their blood vessels sometime in life. The blood vessel injury will cause constriction of blood vessels, loss of blood into the tissues, and clot formation by the intrinsic and extrinsic pathways. So during the clotting process, there is local vasoconstriction, which is the first reaction to blood vessel injury. The platelet aggregation. The injury exposes blood to collagen and other substances under endothelial lining of vessels, causing platelets in circulating blood to stick. And this time, there is release of ADP or adhere to the site of the injury. So once they stick, the platelets release adenosine diphosphate or ADP and other chemicals that attract other platelets, causing them to gather or aggregate and to stick as well. AGP is also a precursor of the prostaglandins, from which thromboxane A2 is formed. Thromboxane A2 causes local vasoconstriction and further platelet aggregation and adhesion. This series of events forms a platelet plug at the site of the vessel injury. In many injuries, the combination of vasoconstriction and platelet aggregation is enough to seal off the injury and keep the cardiovascular system intact. The intrinsic pathway. As blood comes in contact with the exposed collagen of the injured blood vessel, one of the clotting factors called Hageman factor, also called factor 7, which is a chemical substance found circulating in the blood, is activated. So our clotting factors, by the way, are often known by a name and by a Roman numeral. So when one of these factors becomes activated, the lowercase letter a is added. Like for example, activated Hageman factor is also called factor 7A, as shown in the slide. The activation of the Hageman factor starts a number of reactions in the area. So both clot formation and clot dissolving process are activated at this time, and the inflammatory response is started as discussed in Chapter 15. The activation of Hodgman factor first activates clotting factor 6 or the plasma thromboplastin antecedent or patty A, and then activates a cascading series of coagulant substances called the intrinsic pathway that ends with the conversion of prothrombin to thrombin. Activated thrombin breaks down fibrinogen to form insoluble fibrin threads, which form a clot inside the blood vessel. The clot, called a thrombus, acts to plug the injury and seal the system. The intrinsic pathway. While the coagulation process is going on inside blood vessel via the intrinsic pathway, the blood that has leaked out of the vascular system and into the surrounding tissue is caused to clot by the extrinsic pathway. Injured cells release a substance called tissue thromboplastin, which activates clotting factors in the blood and starts the clotting cascade to form a clot on the outside of the blood vessel. The injured vessel is now vasoconstricted and has a platelet plug as well as a clot on both the inside and outside of the blood vessel in the area of the injury. These actions maintain the closed nature of the cardiovascular system. Okay, we now continue with clot resolution and anti-clotting process. Blood plasma also contains anti-clotting substances that inhibit clotting reactions that might otherwise lead to an obstruction of blood vessels by blood clot. So for that, we have antithrombin 3, which prevents formation of thrombin, thus stopping breakdown of fibrin threads. Then we have the plasmin or fibrinolysin. So this dissolves clots to ensure free movement of blood through the system, and this is a protein dissolving substance that breaks down fibrin framework of blood clots and opens up vessels. Then, last but not the least, is the plasminogen, which is a precursor of plasmin. So this plasminogen is made in the liver and is found in the plasma. The conversion of plasminogen to plasmin begins with the activation of Hodgman factor and is facilitated by a number of other factors including antidiuretic hormone or ADH, epinephrine, pyrogens, emotional stress, physical activity, and the chemicals urokinase and streptokinase. The plasmin helps to keep blood vessels open and functional, and they are found in lungs and uterus in high level. So we have very high levels of plasmin that are found in the lungs, which contain millions of tiny easily injured capillaries, and in the uterus, which in pregnancy must maintain a constant blood flow for the developing fetus. The action of plasmin is evident in the female menstrual flow, in that clots do not form rapidly when the lining of the uterus is shed. The blood oozes slowly over a period of days. We now move on into disorders affecting blood coagulation. Disorders that directly affect the coagulation process are referred to as hemorrhagic disorders. These disorders fall into two main categories. First, those conditions that involve overproduction of clots or thromboembolic disorders. And second, are those conditions in which the clotting process is not working effectively, resulting in risk for excess bleeding. We go first with thromboembolic disorders. So these are conditions that predispose a person to formation of clots and emboli. So thrombus is a fibrinous blood clot along the wall of blood vessels, frequently causing a vascular obstruction. Emboli, on the other hand, are something that travels through the bloodstream. It could be a plug of foreign object, quantity of air or gas, a bit of tissue or tumor, or it could even be a piece of thrombus. Thrombi tend to form along the damaged endothelial lining. So just like in the case of coronary artery disease or COD, that involves a narrowing of the coronary arteries caused by damage to the endothelial lining of vessels. As the damage builds up, the lumens of the vessels become narrower and narrower. Over time, the coronary arteries are unable to deliver enough blood to meet the needs of the heart muscle, and hypoxia develops. If a vessel becomes so narrow that a tiny clot occludes it completely, the blood supply to that area is cut off and anoxia occurs, followed by infarction and necrosis. With age, many of the vessels in the body can be damaged and develop similar problem with narrowing and blood delivery. So these disorders are treated with drugs that interfere with the normal coagulation process to prevent the formation of clots in the system. The hemorrhagic disorders. So these are excess bleeding, which include hemophilia, a genetic lack of clotting factors, liver disease, wherein clotting factors and proteins needed for clotting are not produced, in bone marrow disorders, wherein platelets are not formed in sufficient quantity to be effective. These disorders are treated with clotting factors and drugs that promote the coagulation process. So we have here our antiplatelet agents, with their corresponding drug name, usual dosage, and usual indication. I will leave it up to you to look closer when you are to get a copy of your PLP. Okay, then we also have anticoagulants. Then thrombolytic agents. We also have anticoagulant adjunctive therapy. And then we have here antiplatelet agents with its corresponding therapeutic action indications and etc. So these antiplatelet agents decrease the formation of platelet plaque by decreasing the responsiveness of the platelets to stimuli that would cause them to stick and aggregate on vessel wall. So you have there its corresponding nursing considerations, diagnosis, and planning. And then we also have anticoagulants, which are drugs that interfere with the normal coagulation process by interfering with the clotting cascade and thrombin formation. And I would just like to make mention that for the drug-to-drug interactions, because of the many factors that can affect the therapeutic levels of warfarin, it is often very difficult to reach a stable level and maintain that level. Okay, so we have there the prototype. So kindly go over them closely when you will get a copy of your PLP. Then we also have thrombolytic agents, okay, which break down the thrombus that has been formed by stimulating the plasmin system. And that process is called clot resolution. Then we also have other drugs affecting clot formation, okay, which are also effective in preventing thromboembolic episodes. So these drugs include the low molecular weight heparins, adjunctive agents used to help alleviate adverse reactions to these drugs, and one hemorrhagic agent. Then we also have drugs used to control bleeding. So in the other end of the spectrum of coagulation problems are various bleeding disorders. So this include hemophilia, in which there is a genetic lack of clotting factors that leaves the patient vulnerable to excessive bleeding with any injury. Liver disease, in which clotting factors and proteins needed for clotting are not produced. Then the bone marrow disorders, in which platelets are not formed in sufficient quantity to be effective. And we have to take note that bleeding disorders are treated with clotting factors and drugs that promote the coagulation process. So this include anti-hemophilic agents and the hemostatic agent. So bleeding disorders are treated with clotting factors and drugs that promote coagulation process. So we have there the drugs used to control bleeding. Okay. So I will leave it up to you to look closer. Then furthermore, we have the anti-hemophilic agents. So these are drugs used to treat hemophilia, and they are replacement factors for specific clotting factors that are genetically missing in that particular type of hemophilia. Okay. Then our prototype. So kindly look closer also into the prototype, since this could be easily remembered by you and relate it to drugs of same class. So our hemostatic agents, okay, could either be systemic hemostatic agents or topical hemostatic agents. So when we say hemostatic, they are agents that are used to stop bleeding. So as mentioned, it could either be systemic or topical. Okay. So, and this is the end for this set of slides. Thank you for your attention.